Hey you guys, today I'm going to show you what in the hell is this. If you've never seen this before on your arm or anywhere in your body, this redness pus coming out is called a abscess infection. How do you get this? Well, there's lots of ways you can get it. One way of getting this is bacteria transfer to the skin by any contaminated object. Pretty much any object could be contaminated with germs and bacteria, no matter what. And you're wondering how to cure this. The only way to cure this is to either get a needle, but the needle has to be clean, has to be really clean. You have to sanitize the needle, boil it or whatever. And what you're gonna do, you're gonna poke a little hole on it and let all the pus and all the blood drain. All of it. This will hurt, but you need to let all of it come out until the swelling goes down. And once you feel your skin is not hard but a little soft, that's the sign of good, that lots of pus has been drained out. Okay? What you want to do is put hydrogen peroxide on it, put rubbing alcohol on it, put antibiotic cream. That's what you want to do. Let me show you this. And good thing is, always carry a first aid kit, no matter what. Always carry one. You never know when you need one. It's going to look like this. Antibacterial antiseptic cream. First aid cream. It's gonna look something like this. I don't know if you can see it. But it's gonna look something like this. What you have to do is apply this every night and every morning. Okay? You want to apply hydrogen peroxide. You want to apply rubbing alcohol. You want to apply iodine. So you want to apply this. And what you want to do is always keep the area clean, no matter what. Always keep the area clean. And then what you want to do after you applied all of this already, what you want to do is put it in a gauze. Don't wrap it, but put it like in a bandage, in a gauze, and just leave it there for maybe like 1 or 2 days, and then after that, always clean it. Always clean it. No matter if it's clean, dirty, or whatever, always clean it. You always have to clean the area. Always. And when you want to do on your other hand that you don't have the abscess, you want to do is use hand sanitizer. You want to use a lot of it on your other hand. You do not want your other hand to be contaminated. And you guys out there who may or may not have this is contagious. By if you touch somebody with your pus, they will get it. Or if you pus somewhere and somebody touched it, or by accident it went on their skin, they will get it, because this is bacteria. And it was a little bit worse than this, and I had to go to the hospital. And what the doctor did, he got a needle. The needle looks something like this. It looks something like this, but with a really pointy point. What he's gonna do is he's gonna numb the area. Once the area of the skin is numbed, he's gonna poke it. And a lot of pus and blood is gonna be coming out. And then he's gonna squeeze it until all the pus and the blood has come out. After that, he's gonna make an incision, and he's gonna keep poking it, and he's gonna keep pressing on it and taking all that nasty bacteria, pus, all that. He's gonna take all that out, keep taking all that out, and then he's gonna put a gauze on it or whatever. And then what he's gonna do is he's gonna prescribe you antibiotics. He's gonna prescribe antibiotics. You're supposed to take this by mouth every 12 hours for 7 days. For 7 days. But some antibiotics, you only have to take it for 5 days. This is 800 milligram, 160 to 800 tablets. This antibiotic is pretty strong, so you want to take that as directed by your doctor. And what you want to do is, the last thing you want to do once this is cured, you want to prevent it from happening again. How do you prevent this from happening again? You sanitize your whole entire freaking house up and down. You freaking sanitize it. And anybody who comes in your house, make sure they use hand sanitizer, because their hand could be fucking dirty and you don't know what the fuck they got in their hand. Make sure they fucking use hand sanitizer. This happened to me about 3 days ago when I was cleaning my friend's apartment. There was dust and I didn't wear no gloves, and probably some bacteria or something went in my skin and it caught an infection or whatever. You could see all the pus and blood coming out of it. Can't really move my hand, you know. But use all these products. These products should be no more than $1. These should be no more than $1. Okay. If none of this works for you, the only way to really cure this is to go to the hospital. And when you go to the hospital, they will do surgery on you. And they will really open you up and do some serious surgery.